Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to talk about UTI. And this is just a general information about UTI. And if you have curiosity, like what it is, so I could go over it and explain you what it is. So, UTI, or also called as urinary tract infection, is basically, as the name it suggests, it's an infection of your urinary tract, which is the tract followed from kidney to your bladder to your urethra. So sometimes there is infection either due to illness or something, your kidney is infected and your bacteria kind of travel through this tract and starts infecting all of this. But usually this is rarely, but most of the time it's the bladder and the urethra. So it's like when you're trying to pee and it gets infected, most likely due to holding the pee too long or using some kind of, mostly it infects women than the males because we tend to urinate frequently. We have very easy means of urination, except for the women where they have to hold in the pee for too long. They have to go through menstrual cycles, which includes a lot of products. So hence their bladder is exposed to a lot of things, which has a really high chances of getting infected by bacteria. Men usually get infected if there is some kind of disease happening or if they're holding their pee for too long. And that happens for too many times, then what happens is if you hold in your pee too long, your bladder muscles kind of go in backward position. So when you, after holding in too long, when you go to pee, it takes a while for you to pee because your bladder muscles were kind of held together. So when it's trying to relax, your pee is also not coming out because it's putting pressure on your pee to come out. So as a result, we were supposed to get all the pee out, but what happens is after holding it too long, you pee not the whole thing, and some of it is left in your tract, and that stays in and starts causing infection. So most likely those are the reasons why you get your urinary tract infection. And how do you know you have problem peeing, you have a cloudy or a foul smelling pee, mostly you have pain, and then also during sex you have pain, chills, fever. Those are the common symptoms of urinary tract infection. Most likely you will see is a cloudy or a dark pee or a very foul smelling pee, or like it's like soapy or foamy. Sometimes it happens also due to excessive protein consumption, so don't get confused if you get too much foam. But if you're getting too many foamy and very smelly pee, then you should go see a doctor. Um, how to cure that? I mean, home best way is to hydrate and make sure you urinate when you have the urge to urinate. Don't hold into for too long that your bladder muscles kind of go back into reverberation. Limit irritants, keep your hygiene clean, wipe your area when you're done peeing, use a breathable underwear, cleanliness. And if you have an UTI, you look at doctor, they will prescribe you a bunch of antibiotics or an antibiotic route, which could also clear that up. Um, and hope it's not such a threatening thing, but it is something you need to take care of. And hopefully, if you have something, if you know that you're getting it, you can see a doctor and get onto an antibiotic route. And if you feel like there was a foamy pee and then it's not there, just drink some water, take care of your hygiene, and you should be good to go. So with that, this video was a general information on UTI and what happens. So hopefully this video was informative, and I'll see you on the other one. Bye for now.